Alternative funding programs are actually mechanisms that health plans and employers use to save money on prescription costs. What they do is take prescriptions, those specialty medications, and carve them out, basically making the individual underinsured or uninsured for that specialty prescription. And then patients have to go out and find an alternate means to affording those prescriptions. And sometimes that's through charitable patient assistance programs, which is really hard because what it effectively does is it delays treatment for the patients, which if you're living with a life-threatening illness, a delay in treatment can be a critical issue in terms of treating that disease, and forces people to access those charity resources when in fact they should be insured for those products because they're paying their insurance companies for that service.
The PAN Foundation wants alternative funding programs to be abolished. We need to do all we can to educate elected officials about the egregious practices of these alternative funding programs. We want employer-sponsored plans to keep specialty medications in their formulary so that patients can access the medications they need. We want to preserve the safety net that is out here for people who are uninsured and underinsured. We don't want to use those programs for patients who, in the first place, should qualify for access to these medications through their health plans. First and foremost is really to understand their policy, understand what their plan covers and what it may not cover. The second thing patients can do is contact their elected officials. And finally, we hope that patients who may be experiencing the impact of alternative funding programs will share their story, and they can do so easily through the PAN Foundation. Advocacy is really important. We champion patient-first approaches to common-sense legislative and regulatory solutions so patients can access the care they need.